When we sleep, our bodies and our minds rest and rejuvenate. But for Eli Meese, sleep was something he dreaded. On today's All Things Brain Health, we'll show you why going to sleep every night marked the most terrifying part of every day. Good morning, I'm Alexis Del Cid. Welcome to All Things Brain Health. Eli Meese lived with uncontrolled epilepsy for most of his life, and he used to dread bedtime for good reason. When he drifted off, the worst of his seizures would hit. Janine Kiesling shows us the procedure that gave him his life and his sleep back.
After years of being sidelined by epilepsy, Eli Meese is now thriving in the one and only place he's always dreamed of working, his family's business. But the road here wasn't always easy. For most of his life, Eli feared what might happen each time he went to sleep.
I would hallucinate my death, or I would hallucinate being attacked. Once I had one, I had multiple throughout the night. As I got older, the more that my brain was trying to mature, the more that they occurred and the worse they got.
Diagnosed with epilepsy at 6, Eli spent years on medications. At 14, doctors told him he'd likely live with seizures for the rest of his life.
I just was like, okay, well, if that's the case, screw it. I just quit caring about a lot, you know, everything.
Hey, Eli.
Hey.
How's it going?
Yeah, you.
Good, it's nice to see you.
See you.
Then, in his late teens, everything changed when he met Dr. Patrick Landazuri, an epileptologist at the University of Kansas Health System.
He'd never really been seizure-free, and I think he'd always thought that this is just something he'd have to deal with his entire life.
That solution was brain surgery. Eli was 26 and had to make a big decision.
It was scary. It was nerve-wracking. I didn't know, what was going to happen in the end, or if I was even going to make it out of it.
All set? I think so. Now that you're here, I am.
Neurosurgeon Dr. Paul Camerata and the team of specialists carefully removed abnormal tissue from Eli's brain in April of 2017. But they had to be cautious to protect healthy brain tissue. Some affected areas were left behind. Eli was seizure-free for a while, but then the seizures returned. A follow-up MRI showed more abnormal tissue remained, but this time the health system had a new tool, the region's first intraoperative MRI.
I'm going to get the circuit.
This high-resolution imaging allowed surgeons to see inside Eli's brain mid-surgery and remove every last bit of the tissue causing his seizures. The second surgery in November 2017 worked, and Eli hasn't had a seizure since.
The day I found Dr. Landazuri, that changed everything in a positive way. I wouldn't change any of it for the world. It's been quite the wild ride, but I'm right where I am because of all of it.
A future once filled with fear, now full of light, thanks to game-breaking technology, a dedicated care team, and the strength to keep going.
What a story of hope. Eli Meese and the man he calls a blessing, epileptologist Dr. Patrick Landazuri, are here to chat with us today. We are also joined by psychologist Dr. Kelsey Sewell. Dr. Sewell, we're going to dive real deep into the emotional impact of this as we discuss this program. First of all, Eli, how did you sleep last night?
Oh, fantastic.
Now, I heard you and Dr. Landazuri talking about baseball earlier this morning. Did you catch a ball at a Royals game?
I didn't. We got to do that once. That was a really fun time.
Yeah.
Nice. So, describe your life when you had those seizures and you were dreading bed every night. That must have spilled into every aspect of your life.
Yeah, it was hard to be able to stay focused during the day, and then as I got older, the epilepsy progressed, and it got worse. I think what you can kind of touch more on this, as you guys are, the doctors, but, the more that my brain developed, the, faster it was trying to fire off, and so the more that I would have, and then once I had one, and it would cause me to have higher stress levels. And then once I got higher stress levels, it would just go into just this one after another. And then it would be just kind of a, you know, just no sleep really much at all. You know, maybe some nights getting a couple hours here and there maybe. And the older I got, the worse that they got. And the more that they occurred, and it became, you know, really, you know, it's like, all right, well, we need to, you know, make a change for the better, and, you know, whatever it takes. And that's when I think we started talking about surgery. But as a, you know, as a younger, you know, boy, yeah, it was scary, you know, but at the time, you know, I had parents, you know, who were very supportive, and, you know, but I had doctors, and before I went to the KU team, which my Aunt Rita was Dr. Rita Hyde was the one who introduced me to their team. And before that, the reason that I just kind of given up on all hope, and as I had got into my teenage years, just kind of given up, was because a doctor had told me that I was going to be on medicine for the rest of my life, and I was going to have seizures forever.
How awful to hear that at 14?
Right. Yeah,
when
14,
you heard that?
14 when I heard that. And so then the next years, it was just like, well, if I'm going to have seizures forever and I'm going to be like this, then, you know, I ended up, you know, hating life, and, you know, it was just like, all right, well, then why am I even here kind of thing.
Oh my gosh, that's awful.
And yeah. And my aunt, I think my aunt could see that, and she knew that. And then when I turned, I don't know the exact year, but maybe 18 or 19, my Aunt Rita approached me at a family gathering, and she was like, hey, you know, KU's really stepping up their neurology program and cardiology, and why don't you come out for a visit? And that's when I had met Dr. Landazuri, and, you know, one of the first conversations was he was like, you know, hey, look, like, we're going to get these like seizures under control, and we, you know, I can't remember the exact words, but it was like, we're going to, you know, basically we're going to heal you, and
God,
you know,
amazing.
yeah, and follow through, you know, and he kept his word along with the whole team, and it was just, it had been a blessing ever since. And but going through them was, yeah, fearful, because I would have these hallucinations of being attacked or dying.
Horrible, horrible night terrors, or hallucinations.
And the most interesting thing was I would even know, I could feel them through these pre-auras, which was an interesting thing to get down the road, or we can talk about down the road, is I've actually talked to somebody else who has dealt with pre-auras, and he's a young man, he's like 13.
A pre-aura?
Yeah.
Like a sense or something that was coming on?
Well, like for mine, for people who know what it feels like to touch like an electric cattle fence, you know, it sends this electrical shock through your body. But I would get this electrical shock through my left leg, and it felt exactly like when you grip onto an electric fence. And it would send this electric shock through my left leg. And fortunately, as a young man, I had an older brother, and, you know, I had my dad or my mom at the time. If I could get to them in time, it may help some. But I had absolutely zero control, and so what would happen is just, it would be like a switch in my brain, an on and off switch. And it would just,
shock, and then
a shock, and it's like, you know,
gosh,
and so then I'd either run to my brother's room, and I would just jump on his bed because he could grip or hold on to me. Because if not, you know, like sometimes it would just be, you know, sleeping in the middle of the night, and I'd wake up, go right into it. But if I could feel them coming through the shock, I could go find one of them, but then a switch would flip, and I would just go running, and, you know, run into a wall, fall down the stairs, you know, into a door, and then when the seizure would be over, which I, you know, have zero control over, you know, I'd walk back to my room, sheets everywhere, hole in the wall maybe,
oh my gosh,
you know,
and this
maybe
was your
stuff
whole
on my
life?
bed. Yeah, it was from 6 to 26.
Holy smokes.
Yeah, and so, yeah, but the interesting part about all of that is, you know, you really can't understand what true happiness is unless you go through, you know, these dark times in your life and then make it through it. And, you know, understand that you just have to kind of keep waking up, and you have to keep pushing forward, because, you know, the world can be dark, you know, and, you know, for me, because I guess if, you know, we don't have to go down that route, but, you know, I'd curse and be angry, you know, like, why would, you know, God even put me here if this is what I'm going to go through? And full circle, you know, so I could wake up and be as happy as I am today, you know what I mean, and be as joyful as I am, because, you know, you kind of get an understanding of what, what it means to just not, not have control over your own life.
You walked through the fire,
Yeah.
and you came out the other side of it, and that's such a great message for so many people are struggling with so
Yeah,
many
for
different
sure.
things,
Yeah.
and the words you say are going to resonate with people watching who are
I hope
struggling
so.
with
I
something.
really do.
Dr. Landazuri, sorry, Landazelhands, what is it about epilepsy that makes the seizures worse at night, or made them worse at night for Eli?
Yeah, so there are some parts of the brain, obviously one of the parts being Eli's, that seizures are more common at night. There does seem to be something about the transition from your wakeful brain to your sleep brain that makes seizures more likely around that time. And so it's just that's the way some people's are. The three most common types of epilepsy either happen like right when you fall asleep, kind of in the middle of the night, or right when you wake up. And so Eli's, I think, were more kind of like somewhere in between when you went to sleep and when in the middle of the night. 'Cause I don't think they were
Trying to
yeah,
relax
yeah,
and
I-
shut down.
Yeah.
So when some people might feel, that feeling like you're falling off a cliff, right? When you're falling asleep, you get that feeling. That is the point when Eli would have a seizure.
It could be.
That
I mean,
kind of-
it wasn't necessarily that time, but yeah, there is something that's unique, and I'm not sure we fully understand about that transition from, and we can see it on EEG with the way
Wow.
that brain waves change, and it's just there's clearly there's a physiologic change, and for whatever reason, in some people's epilepsy, it's more common at night.
You described feeling blank and feeling despair. And if that earpiece is bothering you, you can take it out now. We just wanted you to have it on so you could hear the story about
Sure,
you. But
sure.
you're okay.
Yeah,
You can
sure.
put that over your shoulder.
Okay.
So when you said you felt blank and then you felt relief, that's what you were describing, is you felt like you were living again?
Yeah, you mean like
After
the surgery?
After you had surgery and you felt better.
Oh yeah.
Just felt
Well, so I think it's important to also share this message that even after the surgery, and it took me 2 years before I could gather the courage to get off of my medications through the fear of being a failure and through the fear of, am I actually seizure free? And those were the things that helped prevent me from having a seizure. And so life directly after the surgery, you have to also imagine that the medications that you have to take, being epileptic, or in any case of a lot of things out there, they alter the way that your brain operates and the way that your brain thinks and the way that your body is. And so trying to get off of all of that and getting past that, it's a lot of work and it's a lot of effort. Even after my surgery and becoming seizure free, I became overweight and I was overeating due to stress of trying to figure out how to be normal. And that through that, I had found that, dieting and exercise was running specifically, because, I could run without any kind of music and it could be silent and I could really work the thoughts out in my head. And because I felt like I got used to, the sick life as opposed to the healthy life. And you have to realize that there are no more excuses after that, and that victory feels good because you feel like you have loss after loss after loss. You aren't gaining any traction in life, and you have to, work hard at it. And it's a bit harder in the beginning, but the reward and the payoff is tremendous. And so I will share the story of, finishing my first 5K. And crossing the finish line, it was the first time that I had felt victory in 20 years.
Wow.
And so, I mean, that's kind of dramatic, but it,
Well, you had dramatic years leading up to that. You're allowed to
But but
that.
true like victory and
Right.
like the feeling of feeling good, and I grasped. You have to grasp onto that and continue to work at that. And it took me, for me, it took years because I didn't understand that there was a process after that that you have to work through to, kind of rewire your brain and body. And so that is, but there are people out there who can, if you find the right people and you ask the right questions, that can help you do that. But yes, it's like I got a second chance at life, to answer your question from the beginning of what you,
Right.
the question you had asked, and I kind of drug it on, but it was a second chance at life, and it's incredible. It is. And you just have to put a little bit of faith and a little bit of trust in, to me, the best team that exists, and that's Landazuri in the neurology department at KU.
What a testament. You should do public speaking. You are one of those people. You really should. You are one of those people that would guide people and coach them towards feeling better. Dr. Sewell, you dedicate your life to helping people through these mental health challenges and these emotional challenges that come from having something like epilepsy or uncontrolled seizures. Is what Eli describes common in your epilepsy patients?
Oh, absolutely. You did a great job describing such a frequent experience of symptoms that people go through. We see depression, so we see it as deep sadness and tearfulness and hopelessness, but we also see people feeling like they just don't have the zest for life, the enjoyment, a little flatter, less motivated, more fatigue, less energy. We see anxiety, especially stuff like that happens at night. People can develop anxiety in response to their seizures. They can develop anxiety with hospital procedures, with leaving the house. We see sleep issues, energy issues, so all those are very common. Also very important to treat because improving mental health usually improves epilepsy, part of comprehensive care, so yes, very important.
We talk about sleep all the time. Getting proper sleep can help with everything, and not getting it can affect everything. That sleep anxiety, that's a real thing. People with insomnia get sleep anxiety. Anyone who hasn't been able to fall asleep understands what that nervousness feels like. I imagine that's multiplied by 1,000,000 when you're trying to fall asleep as a teenage boy. How does that affect your patient's everyday life, not getting enough sleep?
I mean, I think everybody would agree that it affects everything. Feels like it affects everything, right? But we know that sleep issues can make depression and anxiety worse. We know that sleep issues can make seizures worse. And you add in dread of the night, especially when you have awful symptoms at night, and you can develop insomnia really quickly.
Did you have that all day, that dread?
Well, yeah.
Leading up towards sleep?
Yeah, well, the thought, yeah. I wouldn't say, because when I would be active during the day, I wouldn't think about it, but definitely when it was time to relax, it was a nervousness and a stress of just like, hey, what's
happening?
What's tonight going to be? Because and I think a big factor is just not having control over it,
Sure.
When you don't have the option and you have something that's kind of leading your life and not your own decision making, you don't really know, and so then it adds just stress into your life, like you were saying. Stress can amplify having seizures, and so when you do get
chasing
that,
its tail,
and then you wake up the next morning and it's not like you can leave the night before behind you because you're still feeling the effects of
the hangover.
Yeah, the hangover.
Of that,
hangover. Yeah,
that trauma
exactly.
from the night before.
Yeah.
Dr. Landazuri, why do some patients not respond to medications?
There are a variety of reasons. I think maybe the easier way to think about it is that we know that once people fail 2 medicines, that's the definition of drug-resistant epilepsy. And failing 3, less than 1% of people become seizure-free with medicines after that. So it just seems that some people's brains are just better responders to the medicine, just like any disease. I mean, some people respond to hypertension medicines better or cholesterol medicines. So I just think we qualify it based on the number of medications that people try. And I think that's an important message because I think a lot of people worry like, well, maybe if I can get to that 6th or 7th combination, maybe that's going to be my magic combination. And the truth is the research shows that very clearly after that 3rd medicine, less than 1% of people are seizure free. And I don't remember the exact conversation with Eli that he referenced, but I'm sure it was something along those lines of being like, you've kind of done the medication dance and, that's not going to be successful moving forward. And so if we really want to shoot for this, which he did and I did, we ought to think about, can we find out what part of the brain's doing this, and then can we get one of our neurosurgeons, his neurosurgeon was Dr. Camerata, our just retired chair, can we figure that out? And we were able to for him. And I should mention Dr. John Lever, who found his cortical dysplasia as well. So
such a team. You shared a fascinating image with us, and I want to share it with our viewers as well. It's Eli's brain. What did you see in this image that made you optimistic that a surgery would work?
So on the left side of the screen, kind of in the middle, there's a kind of a white little streak. And it's yeah. So
I
if
can't
people-
even. My eyes can't see that, but you're the doctor, so you're.
Well,
Thank God you saw it.
Well,
right?
I saw it after Dr. Lever, the radiologist, showed it to me, because I looked at Eli's MRI quite a bit, trying to figure like what part of the brain's doing this. And with Dr. Lever finding that really simplified Eli's case quite a bit for us. So you can also see it's a bit thicker. If that white streak you see that in the middle, it's kind of kind of this whitish blob.
Yes.
Versus if you look on the opposite side, you see it's kind of distinct with this kind of curls in on it. So that's what Dr. Lever is able to find. And then when I was able to see, I was like, okay, that fits with what Eli is describing. And then Dr. Camerata is like, I can go get that. And he did.
That's so interesting.
Yeah.
And he went and got it. Now, the first surgery wasn't 100% success. Did it have any improvement? Did you?
Yeah, I think it did, because I had gone 3 months without a seizure. And so that was the thing about it, though, was I was kind of riding this wave of hope, and I was like, yes, it's like seizure free. And then 3 months goes, down the road, and I was still, a thing to know was I was still taking my medicine too.
Yeah.
But 3 months down the road, I ended up having one, and it just wrecked me,
Emotionally.
And, emotionally. And so I don't remember the timeline. I think I was 25 at the first surgery and 26 at the second one. And I think we waited, I don't know how long of a period of time it was, but then at one of my appointments, Dr. Landazuri had told me that there was this retired guy, and I don't remember his name, and I wish I would have got it. But he had donated some money, and he teamed up with a bank, and they had gotten an MRI or an IMRI machine, and where it was new technology. They get one into KU, and what it allowed to happen is for Dr. Camerata to cut me open, and then wheel me into an MRI machine in the middle of the surgery, take images to make sure they got everything, and wheel me back out and continue working on me if they needed to. And that was, I think the key, and, and it ended up working.
Alex Brown, one of our photojournalists, just told me the name of the retired man. It's Frank Thompson.
Frank Thompson.
Frank Thompson. So just a good guy that donated a bunch of money to afford this machine that really gave you your life back.
Yeah, and
That's incredible.
Unfortunately, we got to go see him and visit him afterwards and give him, a thank you card and, a gift, and we met him and his wife, and Dr. Camerata was there. Dr. Camerata was there, my dad was there, and I was there. And it was incredible.
Beautiful.
Yeah, and he was awesome. He was this old retired guy, had all kinds of projects around him, cars, and he was, he was awesome.
That's the way to do it in retirement. You don't really retire; you just move on to your other interests.
Yeah, exactly.
It's saving lives. So,
yeah, for sure.
Frank Thompson, man, we love you. Hats off.
Yeah.
Dr. Sewell, before we get to our viewer questions, I want to ask you, going into these procedures that the patients you are counseling have so much hope for, how do you temper those expectations?
It's an important question. I think a lot of it's about the before surgery period and making sure that we do cultivate hope, because that is important. It's a scary decision, like you were saying, and I think we want to make sure people see what we see, which is stories like yours. I think also, though, we want to make sure they know the range of things that could happen, and that we really prepare them for having conversations afterwards about, treating any side effects that might come up or any additional surgeries that they might need. So beforehand, we just have a lot of different layered conversations across the team.
And how long has it been then since your second surgery?
It has been 7 years since my second surgery. And I think a thing to note to what Dr. Kelsey was saying was there are people out there that I have talked to that have generalized lesions in their brain. And so they're not candidates for surgery, but people with local lesions are. And I've talked to people with local lesions and general lesions, and I just wanted to get it out there that if you do have the opportunity to have the surgery, very, very highly consider doing it, as scary as it is, because some people, you know, they don't have that option, and you know, they're looking down the barrel of just what life and fate has in store for them, as opposed to an opportunity and an option. And I think if you can, like I said a little bit ago, just put a little bit of, you know, a lot of trust into, you know, Dr. Landazuri, or whoever your neurologist is.
This team here
Yeah, they have.
at the health
Yeah,
system.
they are the best, and you know, highly consider going through the surgery.
We have questions that people have already submitted before the program. We love when our viewers participate in the discussion during the show as well. So if you have any questions or comments that you would like us to read out loud during the show, just share them with us. You can connect with us in real time by using the chat features on Facebook or on YouTube, or you can email the Medical News Network. All that information is right there on your screen. Dr. Sewell, I want to ask you, what are some of the things that family members or loved ones of someone like Eli going through this should know? How can they support them?
By also supporting themselves. I think that's a really easy answer for me, because I think that it's really scary to have seizures. It's also really scary to watch this person you love have seizures, or for the family to, you know, lose a paycheck or a driver. And I think that that's something we also try to do, is just connect with the families as well and make sure that everybody has good support. And so that would probably be the best answer I could give.
We hear that quite a bit. Caregivers need to take care of themselves
Absolutely.
emotionally. Dr. Landazuri, you didn't perform the actual surgery, but you work so closely with the team that does perform the surgeries. What does that look like, that collaboration?
Yeah, I mean, I would actually say that we're all part of the team. You know, I think everyone's epilepsy surgery team includes at least these, I guess I could list a lot of people, but the neurologist, the neurosurgeon, the psychologist, the neuropsychologist, the nurses that we work with, and for someone having surgery, it's probably 3 or 4 nurses. We have a social worker, we have a pharmacist, so it's really an entire team. And then probably my favorite part of my job is it's every week we have our epilepsy surgery conference where we talk about every patient at KU who's being considered for surgery, and so it's a time where we all get to collaborate in real time and say, you know, this is Eli, this is what this looks like, what do you think we ought to do? Should we go try to remove it right away? Sometimes we do an interval step of putting electrodes inside someone's head to better understand their epilepsy. So it's always collaborative. You know, for people with mental health challenges, you know, Dr. Sewell is intensively involved with that. Like, how can we best prepare that patient for success, not only in the time leading up to the surgery and the surgery itself, but the post-operative time. I think Eli spoke very eloquently about, you know, I think that normalization after surgery is very difficult when you're seizure-free. And so I think it's how can we help someone throughout that whole stage.
I want to get to the questions and the comments because we have them coming in right now. Ruth Allen just has a message for you, Eli. She writes, "What a brave individual. Thank you for telling your story on so many levels." I feel a lot of people feel like Ruth.
Yeah, thank you, Ruth.
Jeremy writes, "When I think about," let's see here, hold on one second. Ruth also wants to know, is there any explanation on why seizures appear late in life when one has never had them before?
For Eli, that's an interesting question, because Eli was born with his cortical dysplasia, what caused his epilepsy. So why did it take till age 6 for them to develop? I don't know. I've seen people with cortical dysplasia who develop it in teenage or even early adult years. They really, by all understanding, should have it from a very early age. So not sure why that is.
Jeremy Yenser wants to know, is it hard to diagnose specifics of seizures or epilepsy since you can't see it happen on command? Like, you can't poke it and say, does it hurt? Or in Eli's case, where it's worse at portions of the night, where you maybe couldn't predict the timing and see it happen? That's a great question.
Yeah, I mean, sometimes, but I think mostly patients know what happens to them. You just have to ask them in the right way. And so I remember when Eli said that he got that feeling in his left leg, that's when I felt very confident we could figure it out, because that's a very localizable symptom. So, you know, there are only two or three parts of the brain that do that. And so you're like, it's got to be one of those parts. So actually just listening and taking a very good history, I think when people think of epilepsy, they think of the convulsive part, but really it's all the part before that that really leads to these breakthroughs, as it were.
And then one more question from Jeremy. What causes the abnormal brain tissue? Is it from an injury, or does the brain tissue just grow that way sometimes?
Both. So in Eli's case, it just grew that way through no fault of anybody's, but the cortical dysplasia basically just means that a part of the brain grows in a spot that it's not supposed to grow in, as it were. But actually epilepsy is most common in adulthood, and that's for reasons like strokes, tumors, traumatic brain injuries, things like that. So it just, things come up.
For some final thoughts on today's discussion, Eli, we could keep you here all day because you're so inspirational. What would you like our viewers and your family to know? Because your dad said the first time he heard you laugh again was one of the best parts of his life.
Yeah, I'm glad that you mentioned him, because I think when someone has epilepsy, there are many things that can help. There's, your doctors, your surgeons, and your parental support, which I think is the most important, because they're the ones that are going to be directly in your life every day. And I had the greatest dad, and I wanted to give him a shout out, because he took me to all of my appointments. He never complained about it. He was there for me and that's when my seizures amplified, is when I lived with him. And it was, just me and him. And he drove me to all of my appointments. He was there every time we were seeing Dr. Landazuri. He was, in my ear all the time. You're gonna get through this, man. You're life's got more in store for you. And he constantly reminded me of that, even at the worst times. And after my first 5K, I ran it with my mom, and we were at the finish line. And the first thing that my dad said to me as soon as I crossed that finish line was, he was like, "You're stronger than you think." And that is something that I constantly just say to myself through a workout, through a run, through life in general, because it's true. And also, if you can get in contact with somebody who has had seizures or is through that, which hopefully my name can get out there and people can find me on, Facebook or anywhere, and feel comfortable to just reach out, because I would love to, just a quick, just small conversation that I've had with epileptic patients before. It's very, it's very motivating when you can look someone in the eye and, for me, if I had somebody tell me hey, I know what you're going through and it's horrible, but, there's a brighter side to life, and you can get there if you just, stay strong and wait it out, put faith in your team, and continue moving forward. And just, and even though it doesn't feel like there is hope sometimes, there is. You just have to put trust in KU's team.
You're such a gift. It's going to help so many people watching. Dr. Sewell, what a gift to have a psychologist on the team that treats epilepsy patients. Not every place has someone like you. What would be your message to viewers watching?
Just that I think it's a really wonderful, comprehensive team, and we have a lot of ways to help support through what can feel like a really scary, difficult process, but we can really be there for them.
Thank you. And Dr. Landazuri, do you have a message you would like our viewers to know?
Yeah, I think that for people with epilepsy, there's probably an option for you that can help. And I think being at a comprehensive epilepsy center often will give you the different options. Eli mentioned that for folks with generalized epilepsy, we don't have as many, but we just recently participated in a trial for people with generalized epilepsy that has a surgical pathway, and we're really confident that that's going to be an option moving forward. So I think, no matter what kind of epilepsy you have, and I think that's maybe that's the piece of advice, just know what kind of epilepsy you have. I don't know how many patients we come and they're just like, well, I just have seizures, or I'm not sure what the diagnosis is.
Sure.
And if once you know that specific name, you can make a specific plan. So I think maybe that's my best piece. Just get your specific epilepsy diagnosis.
Dr. Landazuri, thank you. Dr. Sewell, thank you. And Eli, thank you so much for taking the time to share your journey with us and all of our viewers. And thank you to our viewers for being part of the conversation today. We'll see you right back here tomorrow morning for Open Mics with Dr. Stites.
In hospitals and clinics, AI is helping with data, diagnostics, and documentation so physicians can do what they do best, focus on their patients. I'm Jessica Lovell on the next Open Mics with Dr. Stites. Today, doctors with the University of Kansas Health System show and tell 3 ways that AI is assisting them during your clinic visit, quietly transforming care behind the scenes. Wednesday at 8.